So thank you for inviting me here today. I've been asked to talk about equity in evidence synthesis. And as mentioned, I coordinate the Campbell and Cochrane Health Equity Thematic Group. And I'll tell you what that is in a minute. So for the next half an hour or so, the objectives are to just tell you a little bit about health equity, a bit about how you can think about equity in any systematic review or evidence synthesis you might be working on, and then also tell you a bit about some tools and resources that would be available to you if you were conducting a review and had some questions about including equity. So I'm sure you're aware of Cochrane and Campbell, but just in case, Cochrane is a global organization that produces high quality evidence synthesis on topics related to health care and health interventions. And Campbell is a similar organization using similar methods, but focused on social science. And so their topics include things like education, international development, crime and justice, social welfare. And as the equity group, we work with both Campbell and Cochrane because there are reviews that would have health outcomes that fit within Campbell. And so there's some overlap between the topics of the two groups. And the thematic group is a pretty new type of group within the Cochrane collaboration and within Campbell. And we've been a group within both organizations since about 2007, where we were focused on methods for evidence synthesis, specifically equity methods. And then about a year and a half ago, we became a thematic group, which allows us to do a few more things related to equity within these organizations. So we continue our equity methods work within our first objective, which is to promote equity in the health evidence space. But as a thematic group, we're also able to do things like create guidelines around engaging different types of interest holders in evidence synthesis processes, producing high priority reviews that are focused on important health equity topics, strengthening capacity so authors can use equity in their reviews. And then we've been doing for the last few years a lot of work with equity in guidelines and recommendations. So that's our last objective, is to promote equity within implementation tools. So when we're talking about health equity or health inequity, what we're referring to are differences in health outcomes that are avoidable and that would also be considered to be unacceptable. So health inequities are unfair and avoidable differences in health outcomes. We do actually mean something different when we're talking about inequities and inequalities. So some differences are unfair and some are just inevitable. So things like natural biological variations or health damaging behaviors, if they're freely chosen. If somebody is injured in like a heli skiing accident, we would say that's unfortunate, but not inequitable. It's not a health inequity. So these are inequalities. And then things like lifestyle restrictions or exposure to unhealthy or unsafe working conditions and inadequate access to essential health and social or public services. These would be things that we consider health inequities. And so just one more way to think about it is in this picture, if we're talking about equality, we mean everything is equal. So the people on the left are all given one box to help them reach the apples, and it might not work, but we've treated everybody equally. And on the right side of that picture, we've given people more help if they need it in order to reach their health outcome or to reach the apples. And then on the right side, if we want to achieve equality, we've given everybody a bicycle. But if we want to achieve equity, we've given everybody a bicycle that will suit their needs and help them achieve their goal, which in this case would be riding the bike somewhere. When we're talking to authors of evidence synthesis, we recommend using an acronym to think about the different population characteristics where there could be differences in opportunities for health outcomes. So in Campbell and Cochrane, we use the Progress Plus acronym. You don't have to use Progress Plus, but it's just one way to think about these population characteristics. We like Progress because it's easy to remember and it covers a lot of different topics, but it also allows you to sort of keep the contextual information in mind so that you can really make sure that you're capturing the information that's important to your question. So Progress refers to place of residence, which relates to where somebody lives. So that could be the country in which they live, whether it's a high or a low income country, but it could also relate to the region that they're living in, the city, or even the neighborhood, and how that might impact their opportunities for health. Progress also includes race, ethnicity, culture, language, and ancestry, because all of these things might impact somebody's opportunities for health. We also think about occupation. And so that means the type of work somebody has, but also whether they're unemployed or underemployed and how that could impact their health. Gender and sex, religion. With religion, we're thinking about somebody being discriminated discriminated for their religion, so maybe not receiving access or opportunities for health. But it could also be related to someone like a minor who might be limited or restricted from receiving healthcare because of the religious beliefs of their family or their community, and so how that might impact their opportunities for health. For education, we mean the type and level of education. Socioeconomic status is kind of the traditional thing everybody thinks about when we talk about health equity. But with Progress Plus, it helps you to think of it's just one factor, and there are lots of other characteristics that could impact somebody's health opportunities. And then the last piece of Progress is social capital, and that refers to the social networks or the community or sense of community that somebody has and how that could impact their opportunities for health. And so you might notice in the Progress acronym, there are some characteristics that aren't included in those 8 letters. So Progress was extended to Progress Plus to capture some of these additional characteristics. So with the first bit of Progress Plus, you can include any other personal characteristics that could contribute to differences in health outcomes. So age is the one that's most commonly added, but also could be disability or sexual orientation or any other personal characteristic that could be important for the work that you're doing. So in the specific review question that you have. And then Plus also includes any features of relationships that could impact opportunities for health, or time-dependent relationships. So where a person may not normally be considered to be disadvantaged, but where they are for a short period of time. And when we encourage authors to think about all these characteristics, it's not meant to mean that every review has to think about every single one of these characteristics and report on it. It's more of a reminder that when you set up the review and you're thinking about what you're going to review, you should think about whether any of these will have an impact for your review on the population or on the intervention. So Progress Plus is one framework that you could use. Another one that's probably more well-known is the social determinants of health. And so the social determinants of health cover pretty much the same type of personal characteristics, but they're just organized a little bit differently. But other equity tools would be grade equity, which is mostly for guidelines, but helps you to think about how health equity could be considered in a guideline process. The health equity focused knowledge translation framework gives some guidance around identifying inequalities in health systems and how to think about that. The Include framework provides any type of researcher with some information about thinking about including underserved groups in their research. And the Ethnicity framework specifically helps trialists think about which ethnic groups should be included in order to improve the applicability of their trial results. The Health Equity Measurement Framework is another way to measure social inequities in health. SAGER is a reporting guideline around sex and gender, so to standardize sex and gender reporting in all scientific publications. And then the ETR Health Equity Framework describes the ways that health and education are influenced by the environment and the people, and how to think about that in your work. Okay, so that was a brief introduction to health equity. I think we'll save the questions for the end, but I'll just carry on. If you have any questions about just the general concepts, you can put them in the chat and we can come back to them at the end. So if you're doing a review, why should you think about health equity? So first, evidence syntheses are used to inform health practice and health policy. So considering the distribution of the effects of the intervention and not just the average effects will help the users of the review make sense of the evidence. It helps you to improve the generalizability and applicability of the results. And it can help you think about or identify and assess any intervention-generated inequities. So these are inequities that arise from the intervention itself. So there could be an intervention that benefits only certain groups of the population, which further widens the gap between the most and the least disadvantaged in your population. So thinking about whether health equity considerations are important to your review at the protocol stage and when you're designing your methods can really help to improve the usefulness of your review to those people who you want to use the evidence. So when we started thinking about equity and systematic reviews, and when we were doing some work around reporting guidelines, we thought about what types of reviews would be considered equity focused. So the reviews where it would make the most sense to include an equity lens or to think about how health equity might be affected. So we identified 3 types of reviews. The first is a review that assesses the effects of an intervention, not aimed at reducing inequities, but where it would be important to understand the effects of the intervention on health equity. So the intervention would be targeted at the whole population, but where any effect on specific groups in the population is assessed. Then the second review type would be those that assess the effect of the intervention in a specific population. So they might not have an equity-focused outcome, but where the review is targeting people who have maybe already experienced disadvantages or have experienced health inequity. And so the intervention is targeted at improving their health. And then the third type is a review that assesses the effects of the intervention aimed at reducing social gradients. So this is probably the least common type of review, but there are reviews, even within Cochrane, that are assessing interventions to reduce the social gradients, for example, in smoking. But all reviews can consider health equity. So when we're talking about equity in reviews, we mean more than subgroup analyses. And typically, when we've talked to authors of reviews, the assumption is that if we ask somebody to think about equity in their review, we're asking them to do subgroup analyses. But that's actually just one way that you can think about health equity in your review. So first, you can think about the population and using the Progress Plus characteristics or some framework to think about your population. You could think about whether there would be any differences for the population or for some groups in the population in how they experience the problem that you're interested in or the condition. Or you could think about the intervention. Is there any reason the intervention might work differently depending on the population characteristics? For example, there could be supports related to the intervention that might be different depending on the population group. So for example, if somebody needs transportation or childcare in order to access an intervention, that could impact the effectiveness of the intervention for some groups in your population. If somebody needs to have a caregiver at home following the intervention, if it's like a surgery intervention, for example, then whether they have access to a caregiver at home could affect the effectiveness of their intervention. So there are different places within a review where we can think about health equity. So this is the Cochrane ecosystem. And so the purple circle in the middle is outlining the stages of a Cochrane review. But actually, it would apply to Campbell reviews or any other review, no matter where you're publishing it. The stages of the review are the same. So the same opportunities would be available to think about health equity within the review itself. So the first time that you can think about equity in your review is when formulating your question. So when thinking about your PICO, the population, intervention, comparisons, and outcome, you can think about each of these and whether there could be some impact of equity or some considerations that you could make for health equity. So for example, the population, as I've said, is there anybody specific that you might be interested in the population? For the intervention, is there any reason that it could work differently because of some of the population characteristics? And for the outcomes, would there be different outcomes depending on the population, or maybe there's an equity-specific outcome that you're looking at or that you'd be interested in? And then when you're writing the background, this also gives you an opportunity to think about health equity. So typically in the background, you'll have a section where you'll describe the condition of interest. And this is where you can outline the population and any subgroups of the population who might be affected differently. Maybe there's somebody with a greater baseline risk, or greater exposure to the disease, and you can put that in your background. When you're describing the intervention, you might want to also think about then any differences in the way the intervention could work for different groups of your population. And then you can also mention any differences in the outcomes that you might expect. So for example, these are a couple of quotes from a review on systemic corticosteroids for COVID-19. This is from the second version of the review that had an equity focus, but they said in their background that they used progress to think about equity, and specifically they looked at ethnicity because other studies had indicated that there were some ethnicities with worse outcomes. So they were evaluating the intervention, so the corticosteroids effect on across different ethnicities. And then in the methods, you have more opportunities to consider equity. So here again, you can describe the population when you're discussing the types of studies that you're going to include in the review. So this might make it into your eligibility criteria. You can again use a framework like Progress Plus to identify any populations of interest. You might include specific details like setting for high or low income countries. And then you might describe here any differences expected in the lived experiences of those populations. So racism or stigma, other underlying determinants of health, for example. You can also specify which methods you're going to use to identify and appraise the evidence related to equity and the specific populations. So here you could think about how you're going to extract data and how you'll use it in the characteristics of included studies and in the results of your review. You can explain the rationale for any methodological decisions related to specific populations. For example, if you do conduct a subgroup analysis or to describe your choice of outcomes. And you might use the equity as a way to select your databases. So if you're trying to find specific studies on populations, you might choose different databases to search for your review. And then if it's appropriate, you could even include a logic model to help present sort of visually how everything relates. And so I do have an example. So within the equity group, we support the use of logic models as a way to really think through and demonstrate how the equity considerations might affect the mechanism of action or the intervention. So this is an example from a review that looked at supplementary feeding programs for children. So the logic model shows the intervention and its effects on the implementation process, and then also includes some contextual factors and their impact on the implementation and the health outcomes. So this logic model allows the authors to think about how the child-specific or community-specific context could affect the implementation of the intervention. And so here they're able to show how this could have an important difference in the intervention's effectiveness or in the intervention's implementation. So in this review, families determine how the food is distributed within the household. And so there is a potential substitution happening. So supplementary food is the intervention, but parents or whoever's in charge of food distribution within the household know that one child has received supplementary food, and so could redistribute the food within the home. So then that would sort of change the effectiveness of the intervention. And so they were able to indicate that with the logic model here. And then in the results section, you have another chance to describe your included studies. So you can describe the characteristics of the populations that were included in your included studies. This can be in the characteristics of included studies table, or when you describe in the description of the included studies section of the review, or you can use a new type of table, an overview of included studies and synthesis table, which allows you to bring all the data from the different reviews together to present what population was included, sort of in the same way a primary study would have a table 1 that describes all of the characteristics of the participants included in that study. And one new tool that's been developed by another group called TrialForge is the use of a Pro-EDI table. So Pro-EDI is just a template that you can use to think about basically the progress characteristics, because they're quite similar. And then it allows you to describe who should be represented in the evidence given the disease or illness, and then present who actually was included so that it helps you have the information you might need to interpret the results. And so Pro-EDI is still in development, but it is available on this website. And they do invite you to try it out and send them feedback. So I just wanted to flag that as a new tool for presenting your population. Another way you can present the population is by including a table that highlights some of these population characteristics. So this is, again, the corticosteroids review, but they included a table that looked at the country and the age, and then ethnicity and other equity characteristics that they were able to collect from the studies they included in their review. And then, as I mentioned, you can describe the characteristics. Even a non-equity focused systematic review should still present characteristics of the population included. And so most reviews should be able to present on things like age or sex or the country and present those in their review, even if they aren't intending to focus on health equity. And then in the results, you can provide a brief overview of the assessment and any differences that have been identified. And then you can consider summarizing these, including whether there were any differences in the baseline risk or prevalence of the problem. So you might consider using the summary of findings tables to include additional summary of findings tables, or to include separate rows if you're able to highlight things like differences in baseline risk. So for example, this is the rotavirus vaccine review. And so they did separate summary of findings tables based on the setting so that they could give the different risks depending on the baseline risk of the disease. The last thing is the discussion. So in the discussion, you can include how the population characteristics may affect the applicability of the review. So if there's differences in the effectiveness or the importance of outcomes, you can talk about the applicability of the results for different populations and settings. And now I just do want to mention, I'm giving you lots of extra things to write in a review, and sometimes you're limited by the word limits of the journal. And so these are all things that could be included in supplementary tables so that you're able to present it and comment on it, but it doesn't take up space. It doesn't have to take up space within the body of your review. And then this is just an example of how a review on unconditional cash transfers reported on the applicability of their evidence. So in this review, they have evidence from 15 LMICs within 3 WHO regions, and they're able to say more evidence is still needed, though, in other regions where they didn't find any studies. So all of this information is also included. So how to assess equity is included in Chapter 16 of the Cochrane Handbook, and you can access that online. There's also the reporting guideline. So PRISMA, which is the preferred reporting items for systematic reviews and meta-analyses, is the reporting guideline for systematic reviews. But there is an equity extension, which provides some guidance on how to report all of these equity considerations throughout all the steps or stages of the systematic review. And then there's also an online training resource on the training website for Cochrane. And you can access all these parts of the module that work through how to include equity in your systematic review. And then the last thing is the Cochrane Health Equity Group is available. If you reach out to me or contact us through the website, we can put you in touch with people who could help you if you have specific equity questions, or point you towards resources that might be helpful for you in your work.
Thank you, Jennifer. Thank you for excellent presentation. So here's a question. Would an example of equity be focusing on the different differential effects of a treatment in men and women?
Yeah, so that would definitely be an example. Yes, so you would be able to follow the same steps there and think about whether there are differences in the effective and intervention for men and women, especially if it's not a biological difference, because then it would be a sex-related question, and that may or may not have equity implications. It would depend.
Another question is from Guillaume. Thanks, that was very interesting. If I understood well, equity in reviews is mostly about heterogeneity in spontaneous risk of events and about heterogeneity in treatment effects. You mentioned different outcomes. Do you have an illustrative example?
Yeah, so for the outcomes, it's just depending on the population, certain outcomes may be more important. So if you're focusing on the most important so typically with reviews, we try to focus on a few main outcomes, and then we have some secondary outcomes. Depending on the population, some of those outcomes may be more important to them, and therefore you would want to include them more in the review, or they would be important outcomes. There's also sometimes where we think about equity specifically as an outcome, where we are trying, sometimes there'll be like an equity measure. So if they're looking at the gap and they might report on the gap, and then we would want to include that as an equity specific outcome in our reviews. And so heterogeneity, it's not necessarily about the heterogeneity and spontaneous risk of events, though. I think it might be more about, so if you have, for example, a condition that you're interested in, like diabetes, and it's more prevalent in certain ethnicities than in others, then you would want to have that in mind as you're looking at your studies, because you want to make sure that the studies that you're capturing are going to be able to report on some of that information. And if they're not, then that's a finding. If you're not able to identify studies that report on like the differences in those ethnic groups, then you would want to be able to say that that's a gap in the evidence. So this result is only going to help us with this certain population, but we need to find out more for specific groups. Other ones would be, I'm just trying to think of how to explain a different. So like the corticosteroid one, there was an original review published, and then we were able to say there's certain things here that weren't addressed by that review. And so they were available in the primary studies though. So they were able to go back and sort of look over that information and present on it. Sorry, I'm also reading the text, the chats that are coming through. But yeah, so basically what we find often when we try to look at the reviews published in Cochrane and Campbell and other journals, we try to see what they've done with equity. And a lot of times people will say in the background, we know that this disease is more prevalent in this population. Or especially with sex and gender, it comes up and they'll say this disease is really a problem for women. And then that's it. That's the whole extent of the discussion of equity within the review, even though the primary studies might have talked about what's going on there or might have presented that information differently. So we're not saying you have to do a subgroup analysis, but following that sort of train of thought through the review is helpful then for whoever has to use that information. So if you say it's more prevalent for women, then you should tell us, well, were women included in the studies that you looked at? And then you should tell us, was there anything happening differently for those women? And if not, what would that mean then, the results of the review for women, for example? This was a common example we used to use. I think it's getting a bit better now for sex and gender. You would know, Ciprian, with the hypertension reviews. But yeah, so that's sort of it's sort of a bigger picture than just like the heterogeneity and the spontaneous risk. And then the pro-EDI table, actually, yeah, so that's new. And that's I can send you the link in the chat so you can see it. And that's not by our team, but that's by another team in the UK, but it's a really useful tool. So I'm going to put it in there. And it shouldn't add too much work to your review to think about. Basically, it allows you to think about what's the picture of the condition in the real population, and then how does that compare to the studies that you've included? So similar kind of ideas I've been talking about, and they are looking for people to try out that tool. So if you're interested, you can get in touch with them.
So Sharzad, you can just unmute and ask your question.
I noticed that you mentioned for the purpose of equity, we don't have to do subgroup analysis. But I'm wondering, in case, people think they need to do subgroup analysis for specific groups, do you recommend that it should be mentioned in the protocol, or they should be upfront if they want to do that?
Yeah, so subgroup analyses are great if you can do them, and if they're pre-planned and they follow all the rules. It's just we're hesitant to say you should do them all the time, because we don't want to just be known as the people who are telling you to just, if you keep doing subgroup analyses, eventually you'll find something that's important. So that's sort of been the reason we're a bit more hesitant on it. But subgroup analyses have a place, obviously, and they're a good way to explain what's happening with equity. So yes, you can do them. And we would just recommend explaining which subgroups you're interested in and why. And then, and it's also okay for them to come up later but be labeled as exploratory and be made clear that that's sort of a change from what you planned.
Thank you.
And then there's a question about whether we think that future journals will require some sort of consideration. And the newest thing is Cochrane will be requiring you to think about equity. So if you write a Cochrane review, there are headings for equity. And so you do have to say what you're considering with regards to equity in the review. And if you say, no, we don't think equity is important, you will have to explain why you think equity is not important. So that will be a new thing there. And that's why we're trying to create some tools to help people to fill that in as it goes through. And we're working with the managing editors within Cochrane to be able to help people when they have a question about what should be included.
Do you know how many journals require this?
I don't know off the top of my head. I know a lot of funding agencies require at least a sex and gender consideration to be. And so that's sort of the start. And then all of the other equity considerations, I think post-COVID, it's been a lot easier to get people to think about why equity is important, where before it was really income and like subgroup analysis was all people thought about. But yeah, I think it's getting a little bit, it's an easier sell now. Everybody sort of gets it.
Well, I have a question. Do we have any evidence that looking at equity in evidence synthesis has any effect?
That's a good question. Well, actually, I don't know if there's been any like an evaluation of it, but I know that the push for it has come from the policymakers themselves when they need to have an answer with respect to specific populations. And so it's maybe not been evaluated, but it's the equity considerations in the reviews are meeting the needs of the policymakers or the people who actually want the evidence. So I think that's probably a sign that it's filling a gap there.
Here's one. It says right now, from Kate Miller. Right now, it seems like frequently all we can say is further research is needed because we can't answer the equity-related questions. Will it get better?
I think so. Yeah. So that's always been the criticism, not just even with equity reviews, but Cochrane reviews in general, is that the findings usually are we can't answer, more research is needed. But I think it is getting better because especially post-COVID, because people are thinking about this in their primary studies. So there's more data available to us when we do reviews, and there's more information around even just thinking about contextual factors. So even if there's no data specifically or disaggregated data, there is some mention of different contextual factors that might have influenced the results of a study that you can use in your review. And so I think it is improving, and the reporting is improving of primary studies and of reviews. So it is getting a bit easier. It's still a lot of, if you look at the reviews, it's still a lot of sort of like in the background and then in the applicability, and there's not much in between. But I think it's also, systematic reviews are really complex on their own without all these additional considerations. So I think that it's just sort of like making it part of your standard practice will improve it. So I think the headings in Cochrane, making people think about it, will make a big difference on improving it.
So on Monday, a group of us here were discussing, and a few of my colleagues are in the process of writing Cochrane reviews, and now there is the new section on equity, and suddenly they're like, oh, what do we write there?
Yes. Yeah, we're in the process of preparing a tutorial and guidance on how to handle that. At the moment, you're able to speak with the managing editor to get some help with it. And then soon in the fall, we'll have, or I guess in September, we'll have a tutorial that goes along with it. So there's some guidance on what to do with each of those aspects of the review. But so far, they're trying it out to see what comes in and what maybe needs more guidance. Yeah.
So the idea is that will kind of summarize the equity aspects of that review.
Yeah, exactly. Yes.
Another question. In follow-up to questions about equity analysis, I find often the structural system, that is decision makers, state their preference. However, system access to vulnerable population is so low that analysis has to happen at a macro level.
Yes, I think that's probably fair, but I think we have to start somewhere. So as long as we notice that there's an issue and we can start trying to think about it, then it gives us a way to start thinking about how we can get the information that we need. And so we're just happy that people start thinking about it, because once it's on your radar, then you can design better studies and you can get the information that you need.
I just thought of another question, and that is because you also act as an editor in the thematic group, and you see a lot of the draft reviews that come in. What is the most critical equity aspect that seems to be most prevalent?
For us, it's just really planning it from the beginning. So thinking about the beginning, thinking about the question, and really taking the time at the beginning to think about what could be the things that are happening with regards to the population or the intervention, and how might you handle that throughout is sort of the biggest step, because it's sort of, if you don't start out looking for it, you might get it from, you might find it way later, and then you have to go back if you think, oh, that was kind of interesting. It's sort of like thinking about it right up front and outlining everything that could help you answer that question is the best way to get started. Yes, and exactly, it becomes a KT issue. So, and how to make sure that people understand that the applicability of the evidence if it's not really clear there. Yeah, but we're trying to help authors to be able to explain it better.
Great. Thank you very much. Thank you, Jennifer, for an excellent presentation and taking all the questions. We may have you back to explore this further, but for now,
Great.
thank you very much.
Okay, thank you.
And thank you everyone for attending.